Obviously, special needs child is going to elicit some stress in a marriage. I know that firsthand, having two little ones. There are times where you feel like you may want some help. And parents that are struggling within their marital relationship, what's your suggestion where they should turn to first? Maybe to talk about it, to seek guidance. What are your suggestions for mom and dad?
Well, there's different kinds of stress that parents experience, but let's say that you have a really rowdy kid and who's unusually mischievous and is often in trouble at school, or and it's a constant stress. Those parents are well advised to get a psychologist to consult with them on just how to manage their child, and because that, the stress, chronic stress of having conflicts about how to raise someone who's really difficult, can really cripple a marriage. And so having a place where you can kind of talk about the pros and cons of different approaches and come up with a joint plan that both parents commit to subtracts a huge amount of conflict from the marriage. And then if parents are having other issues like with intimacy or communication, they can certainly see a couples counselor for that. But those things are really kind of different. Some kids they're just extraordinarily difficult, and it wouldn't matter if you were raising them or Mother Teresa. It doesn't matter. They're just really, really difficult kids, and they need an additional level of support.
Yeah, so maybe long term, parents can, obviously have a mental health provider for their child, but for long term, maybe they can have a mental health provider for themselves, right?
Yeah, that's right.
Sort of like making time, not, if we're going to go and speak to this professional, but it's, sort of incremented, just like your child is going to go see a mental health professional, correct? Yeah.
Yes.
Absolutely. And I think what's exceptionally challenging within a marriage is that with good intentions, one spouse might say, well, look, I found this strategy on the internet, or I read this book, and let's enthusiastically go and go forth on this journey using this book I found or this bulleted list. And what the strategies that work for a neurotypical child are not going to work for a kid who is neurodivergent or atypical in some way or has a special need. And that can create so much conflict, especially when parents are coming at it with different strategies. And that's where a psychologist who specializes in parenting consultations can bring the team together, this team of two parents or more if there's step parents involved, and everyone can get on a parenting plan and learn to parent a little bit more harmoniously.
So point taken, don't go to Dr. Google and ask for help with your marriage.
Right. Yeah, Dr. Google
Speak to the healthcare professionals.
Right.
Well, Marty, a good example of this is with regards to medication. There are some kids who are so anxious or so ADHD, they require some medications. And parents can really just go for the jugular over this because one person wants the medication and the other person doesn't. Typically, we find that it's helpful to work on this in parent consultations and just choose one strategy that you're both going to support. So if one person hates the idea of medication, maybe you decide, all right, we're going to do everything behavioral wholeheartedly. And we're going to do that, and we're going to give it X amount of time. And if that doesn't work, we're going to call it, and we're going to add the medication. But you make a plan where you're working together instead of, getting the medicine and one parent's bickering about it or undermining it. You just need to be doing everything together.
And to your point, personally, with my child, we were sort of on the fence whether to medicate or not with my special needs child. And how about trialing medication for a short period of time? Let's say, per the doctor's recommendation, 30 days, 60 days, and then we kind of see where we're at. I mean, is that a viable option for parents to try with when mom and dad aren't really agreeing on whether to medicate or not, right?
That's a yes-no. Sometimes that could work. Like with a psychostimulant, those are medicines that take effect really quickly. and the child pees it out in the same day. So you can see if it affects the child within one day. And so usually pediatricians start at a low dose, and then they might incrementally work up. So you could get to the ideal dose in a smaller period of time. Other medications take up to 3 weeks to get on board, and since pediatricians start with a low dose, it could be that 3 weeks come and nothing's really different. So it could take a really long time. Or the medication just doesn't suit the child at all, and you have to abandon that and go to something else. So essentially, if you're going to try medication, you have to be really committed to working with your pediatrician and teachers, other parent, for a long haul to try to get the right medicine.
So again, open, frequent lines of communication.
Right, yes.
The point here.